Are you sick and tired of being sick and tired? Did you know the normal number of headaches is 0? Do you really think your back went out because you slept funny? Welcome to the Ottawa Chiropractic and Natural Health Centre. Their unique expertise allows Dr. John Zielonka to find the underlying cause of your problem and help you achieve your health goals. Their comprehensive approach includes the very best in chiropractic, specialized exercise, custom orthotics, the world's best vitamins, aqua massage, and so much more. Ottawa Chiropractic and Natural Health Centre has helped past prime ministers, the world's fastest man, army generals, and they'd like to help you. If you'd like to experience a lifetime of health, please call Dr. John Zielonka today. Consumer Choice Award, helping you make better choices.
Hi, I'm Dr. John Zielonka with Excellence in Health, home to the Ottawa Chiropractic and Natural Health Centre, yourhealthstore.ca, and custom-orthotics.ottawa.com as well. This is the doctor's report. I'd like to welcome you. This is one of 68 different health lectures we do as part of the Human Performance Lecture Series. Easily the most extensive health series in Canada. It's also the one that we consider to be the most important. If you've been asked to watch this, most likely you have just completed a consultation and examination with me. This particular health lecture will teach you exactly what you can expect during the course of care with us and also how you can maximize your results as well. Okay. We are based on 5 core values: leadership. There really isn't anyone in our healthcare system today who really is taking leadership. We live in a sick care system and we need to be led into the health and wellness system. That's something I'll be talking about as well. Certainly trust. There is so much misinformation out there and you really do need someone that you can trust to help you achieve the level of health that you're looking for. Certainly integrity. We will always tell you everything and we will always stay true to our values. Speaking of truth, I will tell you the truth whether you want to hear it or not. And unfortunately, that is something that's not happening in today's day and age as well. And the whole goal of all of this is to help you achieve your true human health potential. We're very serious about health, so serious in fact that I founded National Health Day in Canada almost 10 years ago. As I said, we do the most extensive health series in the country. I've done over 100 TV appearances. The question is, how serious are you about health? And that's really now what I want to talk about, is you can read my credentials, you can hear all about our clinic, but really this is all about you. And so the question I have to you is, are you sick and tired of being sick and tired? Are you in pain? Are you living on drugs that by masking your pain you now think that you're healthy? None of this has anything to do with what true health is all about. And most importantly, are you ready to change and are you willing to change? That's a decision that only you can make. I will tell you all of the keys to health. We'll get to this in a minute. But understand that the biggest factor in your health is what goes on up here. Okay? The decisions you make, what you value, what you prioritize, and so forth, and that's what we want to help you with today. Right? Because the question I have to ask you is, what type of lifestyle does the average person have? And the answer is actually quite frightening if we think about it. I want you to do something very simple for me. Think of maybe 9 different family members or friends that you have, and you would be number 10, and picture that you're all together in a room. And then what I want you to realize is 9 out of the 10 of you are going to die of a disease that was preventable. Right? 9 out of 10. That's crazy. Right? We live in a world today, right, where there are 1.2 billion people starving, but there are also 1.2 billion people that are obese. Right? What kind of world is that we want to live in? Right? And for the first time, in the history of mankind, one of the things, I'm a parent, I have 3 children. Every parent wants a better life for their children. For the first time in the history of mankind, our children now have a lower life expectancy than we do. There's something wrong with that system. Okay? That simply does not work in a healthcare system. So that's one of the things that I want to talk about today, is I want your permission to introduce you to a new system. And it's really not new, but for a lot of people, they simply don't live this system. There's a difference between what we call the sick care system and what we call the health and wellness paradigm. Right? My center is all about the health and wellness paradigm. That's what we'd like to teach you about. That's the path we'd like to see you take. But understand, we live in a world, right, where society tends to have 4 different approaches to health, and they're all based on sick care. And that's why you'll see on the slide the word health is in quotations here. Number 1, people have some sort of symptom, some sort of pain, and they simply ignore it. Okay? This is your body's warning system telling you there's something wrong. You need to take action on this. Approach number 2 is they have some sort of symptom or some sort of pain, and they simply do something to mask the symptoms. This happens far more than you realize. This is why Tylenol is a multi-billion-dollar drug company. You're not getting anything back to the state that it should be. You're masking the problem, and in fact, in masking the problem, you may in fact go out and hurt yourself even more. Number 3 to me is more like a Three Stooges movie. You have some sort of ache or some pain or some symptom, and you simply avoid doing whatever causes the ache or pain. That's like, doctor, it hurts when I go like this. Well, just don't go like that anymore. Doctor, it hurts in those 3 places. Don't go to those 3 places. Right? That's ludicrous. What we really should want is approach number 4, which regardless of your symptoms, right, regardless of whatever you're avoiding, you want to achieve a maximum level of what true health is all about. Because you're led to believe, right, you're led to believe that sickness comes from bad genes, bad germs, and bad luck. And as long as you believe that, and as long as we have a sick care system that tends to reinforce that, you will be on a self-fulfilling prophecy to being one of those 9 out of 10 people who are going to die of a preventable disease. Understand that there is a dictionary definition to the word health, and health is defined as the optimal state of physical, mental, and social well-being, and I would add spiritual in there as well, and not merely the absence of disease or infirmity. So understand there are 3 key points to this definition. Number 1, they're not just telling you what health is, they are actually telling you what health isn't. There is no other word that I know of in the English language that is defined that way. That's like saying an apple is a fruit, which is not a banana. Number 2, very much a holistic approach, physical, mental, social, spiritual well-being. And number 3, by its definition, it is the optimal state. I'm actually guilty of charged because I use the term optimal health all the time. And really, if we understood what health meant, I'm actually being redundant when I stick optimal in front of health. It really should be optimal health already. This here, you'll see the slide in a second here, this is something I'd also like people to understand, is on the health continuum, we can go all the way from what we call optimal health down to death. Okay? And yes, we are all eventually moving this way, unless you come out to lecture 55, where I'll talk about ageless body, timeless mind, quantum physics, and how your energy fields will live on forever, but we won't get to that right now. But understand we do have a say in how quickly we move this way. We all understand that disease begins long before symptoms appear. This is true in everything, not just what I see in the office here, but this is the guy who dies of a heart attack, and then people say, wow, and he was so healthy. And I'm very sorry, but healthy people do not die of heart attacks. The arteries were clogging up long before that. It's like the stereotypical little lady who falls and breaks her hip. The bones were becoming brittle long before that. It's like the person who finds out they have cancer. Well, guess what? Those cancer cells were changing long before that. But what do? We wait for the symptoms to appear, and then once they appear, what do? We take those first 3 approaches where we ignore them, we mask them. One of the most common sayings I hear in this clinic is, I thought it would go away. Well, the only thing going away is your health. Right? And then down here, we have our sick care system. That's not a health care system. Also appreciate that there's a difference between prevention and early detection. Early detection is nice, but early detection is not prevention, and you're being sold this as being the same thing. Early detection will be things like your yearly medical exams or your pap smears or mammograms and so forth, but they're not preventing anything. Right? If you've detected it, you can't prevent it anymore. And then also, last but not least, understand there's a difference between prevention and optimal health. Prevention is nice, and that's what people strive for in the sick care system, but nowhere in the definition of health did it say anything about the optimal state of not getting all the diseases and the bad stuff. It actually went out of its way to say exactly the opposite. Optimal health is about functioning at your true health potential through the course of your lifetime. Right? Unfortunately, understand, in that sick care system, what we're doing is we're really managing disease. Now, please take this the right way. I'm not bashing medicine and the sick care system. Medicine certainly plays a role. I always tell my patients that if I walk across this street and get hit by a car and get a whiplash, first place I'm going to is a chiropractor, because we deal with that much better. If I walk across that same street, get hit by that same car, and get a ruptured spleen, then I thank God that MDs are out there. But I'm not going into that system for optimal health. In that system, understand that 100,000 people, this is according to the American Medical Association and the National Institute of Health, 100,000 people die from so-called properly prescribed drugs every year. Another 100,000 people die from medical errors, and another 100,000 people die from what are called nosocomial infections. These are infections you caught in the hospital that you did not have when you first went into the hospital. That's not a system that I want to be in. I don't know if you've seen the commercials. We talk about this in one of our other health lectures, but now the Heart and Stroke Foundation here in Canada has put out a commercial saying the average Canadian will spend the last 10 years of their life in sickness. Why would you want to strive to get to that point, to spend the last 10 years of your life in sickness? I was doing a radio interview with one of my US colleagues a while back, and he was saying it's not 10 years in the States, it's 20 years. I mean, what is that to look forward to? Right? You know, we have a lot of people who say, well, I hope they're going to get better. We have a saying in here that hope is nice, but action is better. Right? This is a picture of someone, to give you an example of that, who, you know, lived in the sick care system. This is Vanessa. She came to me when she was 18 months old. She had been constipated for 6 months. Okay? The parents took her to 10 different so-called specialists. The hospital's answer for Vanessa was to give her daily enemas. Right? Imagine what that does to an 18-month-old girl to give her daily enemas. Right? 10 different specialists. Finally, specialist number 10 said, well, we're not sure what's going on, but it seems like the nerve is not sending the right message to the bowel. That's when her dad finally brought her in. Dad should have known better because he's a patient of mine who used to get debilitating migraine headaches, doesn't get them anymore with his chiropractic care. I adjust the nerve that goes to the bowel. Right? If you've ever seen an adjustment to a small child, one of the most incredibly gentle things you could possibly do, 20 minutes after that first adjustment, Vanessa had her first bowel movement in 6 months. Okay? That's what the health and wellness system is all about. It's not being reactive, it's about the 5 keys to health. So again, we do a full lecture on the 5 keys to health. We have an audio segment on this as well. Please make sure that you listen and watch that as well. But understand there are 5 keys to health. Right? Number 1 is nutrition. So when we're talking about nutrition, we're talking about eating properly on a regular basis. That also includes vitamin supplementation. The science is very clear on that as well. And the term is supplementation, not replacement. So that doesn't mean you get to eat, you know, like crap and then take the vitamins hoping you're going to repair that. And also metabolic detoxification. Number 2 is exercise. And understand exercise is not just for the body, but for the mind and the spirit as well. We don't need study number 8,000 to tell us we should be exercising. We just need to go out and exercise. Number 3 is part of what I've been talking about here is healthy beliefs. This is one of my first full books that I wrote, Healthy Beliefs, Deadly Choices. Again, the biggest factor in your health are the beliefs that you have up and through here. Right? Number 4 is adequate restful sleep. Understand this is the time when your body heals and rejuvenates and so forth. And number 5 is one of the key things we do in here, of course, is optimal nervous system function. You'll learn this is how your brain controls everything in the body. Understand that all of these are interconnected. A lot of people think if they're practicing good nutrition and they're exercising, then they have true health. Those are 2 of the 5 keys to health. Take any athlete in the world and they will tell you that to be at their top performance without having the nutrition, it's simply not going to happen. Obviously, they exercise more than most average people will ever do. They will certainly tell you that their mental focus is by far the biggest factor that's going on in there. They'll certainly tell you that if they're not letting the body repair with adequate sleep, nothing's going to happen there as well. And they'll also certainly tell you the best athletes in the world all understand the role of proper nervous system function in optimal performance as well. You can't exclude any of these things, and understand you need to practice all of these over the course of your lifetime. I know that's such an obvious thing to state, but in that sick care system we think, oh, we have the headache, let's pop the Tylenol for a minute, and then the headache should go away. You can't eat one healthy salad and expect to be healthy from a nutritional point of view for the rest of your life. Obviously, if you're a patient or wellness client here, you know one of the things we focus on is obviously the chiropractic aspect. A lot of people simply don't know what chiropractic is all about. Chiropractic is a unique, drug-free, gentle, safe, common sense form of natural health care. Its goal is to keep that nervous system functioning at 100% and thus optimize your body's innate intelligence, innate ability to be at that 100% level of health. Right? Understand, chiropractors are bigger believers than anyone that the body has this incredible ability to heal itself. We just go out of our way to mess that up. Right? How important is the nervous system? It controls everything. Understand, from the point of conception, the very first thing that develops is your brain. Off the brain, then there's the spinal cord, off that are then the nerves, and those nerves control the function of every cell, every tissue, every organ in the body. So essentially, your nervous system is your life center. It controls absolutely everything. It is not just your life center, it is also your communication center. Understand, you have 45 miles of nerves coursing through your body. Those impulses travel along at about 325 miles per hour, and those impulses are constant. Okay? They do not stop. Right? Also understand that your body does all of this automatically. I understand that, you know, if I cut my finger, I don't have to think about it healing. I don't have to say, okay, yes, I need a scab to form here, and let's get some fibrinogen over here, and let's change the blood flow that happens here. Your body knows how to do all of this automatically. It knows how to heal automatically, provided it's working properly. Unfortunately, on a daily basis, we subject ourselves to stress. Right? And that stress can be physical stress, emotional, mental stress, even chemical stress, nutritional deficiencies and so forth, or chronic work postures, or old injuries and accidents. The scientific term that chiropractors use is the term subluxation, and understand that not only do nerves not like to be pinched or irritated, but you're then disrupting that brain-body connection, and you're interfering with that life force, with that communication center, and with the body's ability to do all of this automatically. Now, chiropractors have been talking about this for years. It's interesting to now hear some of the better known wellness doctors in the world talking about this. This is Deepak Chopra talking about how our own innate intelligence is far superior to anything that we can get from the outside as well. This is one of my favorite sayings. And look who said this. Right? Humans are designed to be healthy as long as they are whole, body, mind, and spirit. People are characterized by self-healing properties that come from within and an innate health force. Perfect health harmony is the normal state for all life. Now, doesn't that sound a lot more like the actual definition of health and the combination of chiropractic? And yet this was said by Hippocrates, who was considered the father of medicine some 2,000 years ago. How did we get so far away from this and instead into the sick care system that we're in today? So understand, that's what chiropractic is all about, is we want to correct those subluxations. By doing so, the biggest thing we're doing is we're taking the pinching and pressure off the nerve, which your body does not like, but more importantly, we're restoring that brain-body connection, we're replenishing that optimal nerve flow, and hence the body's innate intelligence can heal itself properly. We call it a complex because when that nerve is pinched or irritated, then yes, the muscles will tighten up, they will go into spasm. That's when people often incorrectly think that they have a muscle problem. Understand the joints will become restricted and you'll lose your normal movement. And since all this happens long before you feel it, guess what? That spine will also be degenerating long before you understand that that's happening. And understand, I use the term degeneration all the time. Degeneration is the exact same thing as osteoarthritis. Okay, we need to understand that we need to take care of our spine and our nervous system. It's one of the key essential elements of health. Just we weren't taught this growing up. We were taught to go for our dental exams. We took our kids for our dental exams. We took them for our eye exams. You know, we don't take them for their spinal exams and their nervous system exams. And then we wonder why so many people have problems with their spine and their nervous system. Because appreciate, does anyone know how much pressure it takes to actually decrease the function of a nerve by 50%? It takes the weight of a dime. And I don't mean me taking a dime and pressing the dime into the nerve. If I were to lay a dime on a nerve, I would actually decrease that nerve function by 50%. Now, only 7% of the nervous system actually perceives pain, so that's happening, but you're not necessarily feeling it. And so you're walking through life with your dimmer switch turned down. That's not a healthy way to go through life. Also understand when that subluxation is present, degenerative changes, significant ones, begin within 2 weeks. So contrary to what you've been told in that sick care system where, well, of course you're in your 50s and 60s and 70s now, of course you have the osteoarthritis, well, guess what? Those changes, those significant changes began within 2 weeks. That's what most good chiropractors will put people on wellness programs when they've achieved that optimal level and want to maintain that at a level of twice a month, because it will prevent that degeneration from ever happening in the first place. Because when does all this start? It all starts long before you feel it. Many chiropractors used to think that the first subluxation could occur, you know, during the birth process itself. The truth is it may begin even before that, right? And why on earth would you not want your children to be healthy from the moment they were born? This is another x-ray of a patient of mine. Really nice guy, farmer, lived a couple hours away from the office, in his 50s. He was always talking about getting his 2 children in. He had a 10-year-old son and a 14-year-old son. Finally got his kids in. 14-year-old at the ripe old age of 14 already had chronic back pain, chronic headaches, asthma, and allergies. We took an x-ray, and this is what the x-ray looked like. Now, you don't need to be a chiropractor or a doctor of any kind to know that that's not a normal-looking spine. Well, guess what? That's not the 14-year-old, that's the 10-year-old who had no aches, no complaints, no symptoms whatsoever. And I don't routinely x-ray 10-year-olds, but within the first 10 seconds of looking at a spine, I knew I was going to see this. And appreciate that these progress through your teenage years. So if I'm not finding this, guess what's happening to your kid as this progresses and through there? The nice thing in my office is we leave nothing to chance. Again, if you're a patient or wellness client and you've already had your consult and exam, we've already performed this. This is one of a number of different exams that we do on you. We do the best technology in the city, bar none. This is what's called the MyVision Nerve and Spinal Scan. And this technology comes from the scientists down at NASA. We can literally measure the electrical activity in your nervous system and see what's being disrupted long before you feel it. So this is really used for three things. Number one, it's a great diagnostic tool. Number two, it's a great early detection tool. And you notice I didn't say prevention tool, early detection tool, where we can see things that are happening long before you feel it. And number three, you're going to find we don't just talk to you about health, is we actually show you the progression that you're making. It's a great way to monitor your progression. We can actually show you objectively and functionally the changes that are happening. And more importantly, we can show you when you've reached your true level of optimal health as well. That's one of the key things that we do differently in here, which is why we've won the Consumer's Choice Award for the past 3 years as the best clinic in the city, is we take that overall approach. We will get to the underlying cause of your problem, and then we'll look at all the factors. Again, this has been discussed with you already if you're a patient or wellness client already, but certainly the chiropractic adjustments to restore that nervous system function, restore that brain-body connection. Very specific exercises. We will put you on a better exercise program than anyone, and through the course of your care with us, you'll be put through 5 different phases of exercise. But appreciate 2 things. Number one, it needs to come at its appropriate place and time, and it needs to be specific to you. So the personal trainers, the yoga guys, the Pilates guys, they're all good guys, but there's no way they can know your spine to the level that we're going to know that. Understand, we're not talking your average gym workout. We're talking about things specific to restoring the spine and your core strength back to where it should be based on your individual needs. Number two, needs to come at its appropriate place and time, because a lot of people think exercise is going to cure everything. I've just told you exercise is one of the 5 keys to health. But exercising on something that's already pinched and jammed is not going to fix it. It has the potential to hurt it. But you may, in fact, get away with this for a little while. That's exactly the same as a guy driving his car on misaligned wheels. You'll get away with that, but eventually you'll wear those wheels out faster. We'll put you through 5 different phases. All of the exercise programs are what I call do programs, not watch programs. So we will never hand you a sheet and say, here, go do the average low back stretches or the average neck strengthening. You'll be one-on-one with my exercise therapist, certified personal trainer. I will have told her exactly what to show you to do. She will make you do them. She will watch you while you're doing them. She will do them with you, and you'll actually go through a full workout so we can be sure that you're feeling it exactly where you should be feeling it. Okay? Nothing is ever left to chance. Okay? We have specific and specialized exercise classes. We carry the best vitamins in the world. This is one of my specialties. I hold a fellowship, the only doctor in Ottawa to hold a fellowship in natural supplementation, but nutrient specific to your healing process, whether it's from natural anti-inflammatories to rebuilding disc and cartilage to overall health and so forth. Okay? I'm one of the first 8 doctors in Canada certified in ART, so this is the most advanced muscle technique in the world where we can actually break up scar tissue and fibrous adhesion that is built up in the muscle over time. We have a great massage therapist, and we also have what's called aqua massage in here. We do the best custom orthotics in the city as well. All of these services will teach you how to sit at your desk or computer, and certainly the most advanced health lecture series, as we've said, in the country. Please appreciate one of the key things is you have responsibilities here. Responsibility number one is you need to desire better health. I know that sounds strange, but guess what? This is all about you. This is not about me. If you don't desire better health, if you're not willing to make the effort to get healthy, then guess what? You're not right for us at this point in time, and you're not ready to make that change. If you do desire better health, then you couldn't be in a better center in the city. Number two, you need to keep your appointments. Understand, chiropractic adjustments build one on top of another. It's no different than a weight training program or eating healthy on a regular basis. As I said, you can't eat one healthy salad and then say, okay, I'm done with my healthy eating for the rest of the week. Okay? Each adjustment builds on the one before that. You may think you're getting by if you skip one here or there. Your body will know. And again, we're not focusing on the pain, we're focusing on actually correcting the spine and nervous system back to where it should be. Number three, follow our recommendations. All of them are made in the best interest of your health, and the more you follow them, the better you will get, and the quicker you'll get healthier as well. Number four, ask questions. We actually love patients who ask questions because it means they're taking an active role in their health, and the more that you understand, and especially when you're getting those answers from a trusted health source, again, the better you can maximize your health as well. Follow all of the 5 keys to health. As we said, we practice all 5 keys to health, and they're all interdependent on one another as well. Fulfill your financial obligations. I know that sounds a little strange, but appreciate no one else is going to pay for your health. It's not that health is costly. We like to think that it's actually priceless. We are covered by most insurance plans, but appreciate that most insurance plans are not looking out for the best interest of your health. You will have to pay some of your own money if you actually want to get healthy, but it's worth the investment in your health. Tell others. We actually expect you to refer other people to our office. The reason for that is we're on a mission to get people healthy. And if you're someone who's interested in health and if you follow our philosophy, we expect you to want to help other people as well. And last but not least, appreciate that healing takes time. People tend to have two beliefs in that sick care system, and if we put them together, they make no sense whatsoever. People think that time is going to cure everything. Time doesn't cure anything. That's like a nice romance novel, where time heals all wounds. People believe time is going to cure everything, but then they also believe that we're supposed to get worse and get sick as we get older. Well, they can't both be true. If time cured everything, you would just get better as you got older. Healing takes time. You have spent most likely years and years and years of neglecting that spine, neglecting that nervous system. You will get better faster here than anywhere else in the city, but it's going to take time to restore things back to the way they should be. If you understand all of that, the benefits to you and your health are tremendous. This is a CD that we do called Wellness for Life. It's also a lecture we do. You can watch this free of charge on YouTube, or you can get the CD here as well. But the benefits are incredible, right? Everything from improving the quality of your life, better energy, better sleep, improved athletic performance, better organ function. My favorite out of all these is what we call stronger immune system. Right? At last count, there are over 100 different scientific studies that have confirmed the role of chiropractic in boosting your immune system. This is my favorite study. This is Dr. Ronald Perot, PhD, Chief of Cancer Prevention, and he found in his patients, those who received regular chiropractic care and basically maximized that nervous system function had a 200% stronger immune system than those who didn't, and 400% stronger than his cancer patients. Understand, when we're talking immune system, we're not just talking not getting the common cold or recovering from the flu quicker. We're talking your immune system plays a role in everything: cancer prevention, heart disease, diabetes, and so forth. Understand that the people who follow all of my specific recommendations have shown a 94% improvement in the quality of their life. If you'd like to be one of those people, if you'd like to actually, imagine yourself waking up every morning feeling great, imagine being drug-free, imagine being pain-free, you can stop imagining. You just need to take some action out there. Right? Because if you don't, the only way to coast is downhill. Right? I want to leave off with this last patient of mine, and I know when you see this slide this will be a little interesting to you, as I'm one of only 2 chiropractors in the city who actually used to adjust dogs. I'm a huge dog lover. And if you've ever seen a dog get adjusted, you'll know, if you're a dog lover, you'll know 2 things. You know that dogs instinctively know whether or not you like them, and you'll also know a dog will instinctively know whether what you're doing for them is a positive thing. We've actually helped a number of different dogs. This is Sierra, and Sierra's mother, as I call her human mother, was the woman who founded the program that brings dogs into the hospitals up here in Ottawa. Sierra's no longer with us, but Sierra lived to the ripe old age of 18. If you know anything about golden retrievers, 18 is an old age for a golden retriever to live to. Sierra came in on a chiropractic wellness program. Sierra got adjusted regularly for her overall health. What I'd like you to understand is if we have dogs who have figured out that they need chiropractic wellness care and they need to maintain their nervous system function, then why on earth have you not figured that out yet? And hopefully, if you are watching this, then you have, and you've already completed your, as I said, exam and consultation with us. But certainly we would want the health of the general population to please at least be as healthy as a dog. Right? These are some of the action steps you need to take. Again, if you've already had your consult and exam with me, then congratulations, you're on the road to a lifetime of better health. If you're not, then please call us at 613-688-1036. Book your exam with us today. It's way past due. Understand that, as I said, we cover everything. So whether or not you're looking for chiropractic and optimal health, if you're looking for the best exercise programs, massage therapy, custom-made orthotics, the best nutrition, the best vitamins, we carry all of that here. Please visit us at excellenceinhealth.com. We have a wealth of trusted health information, health articles, health lectures, YouTube videos, TV appearances. We have the Doctor's Resource Center. So you know, one of the difficulties is going onto the web and getting trusted information. The Doctor's Resource Center is a team of over 1,000 health professionals who will give you information on absolutely everything that you're looking for. This, as I said, is one of 68 different health series in the Human Performance Lecture Series. Don't keep this a secret. You're welcome to come to all these. These are done as part of a community service. Allow us to help you and to help others. Share this information. This is not something that we're trying to keep a secret. We want you to know this information, and we want as much of the world to know this information as possible as well. Take control of your health and start taking action now. Thank you for watching this. Please follow the recommendations. Again, congratulations. And we're going to finish off. Just please watch this quick 3-minute video. Thank you.